Throughout 2014, health workers worked despite fatigue to care for Ebola patients in West Africa, while scientists and researchers fast-tracked treatments and anti-Ebola vaccines. Some are already in clinical trials, others will be in early 2015. Although the number of new infections is slowing, until that number gets to zero, the disease could come raging back. In April, the World Health Organization warned that we were entering a post-antibiotic era, where there are no longer effective treatments for common but serious bacterial diseases. The Centers for Disease Control and Prevention says this results in 23,000 deaths in the U.S. alone. Dr. Trish Pearl is an epidemiologist at Johns Hopkins Medicine.
You all of a sudden understand what it was like to practice medicine maybe 50, 70, 80 years ago when there weren't antibiotics.
The World Health Organization is urging doctors to build a data pool of which antibiotics kill which strains of bacteria and to avoid prescribing antibiotics that aren't going to work. Progress in fighting malaria was a highlight in 2014. Since 2000, the WHO reports the number of cases has dropped by 47%. Dr. Pedro Alonso directs the WHO malaria program.
We are making steady progress. In fact, I would actually call it unprecedented progress in the fight against malaria.
The results were largely because people at risk for malaria had bed nets treated with insecticide, along with testing and treatment. Dr. Alonso estimates that more than 4 million lives were saved, good news especially for children, who account for malaria's greatest number of victims. But as always, there's more work to be done. There was also promising research in developing a vaccine to combat dengue, another disease caused by a parasite that's transmitted by a mosquito. Dengue is 30 times more prevalent now than it was 50 years ago, according to the WHO. In July, the French pharmaceutical company Sanofi Pasteur announced that its trials in Asian countries will enable it to develop a vaccine. There are 4 strains of dengue, and a vaccine that might work on one strain may not work on others. But British scientists have discovered molecules, specifically antibodies, in human blood that stop all forms of dengue. The scientists say the molecules offer a roadmap for developing a simple vaccine that could be effective for all strains of the virus. Carol Pearson, VOA News.